Good morning, my name's Kelly. I am currently at home where I live with my husband, 2 kids, 2 dogs and a cat. I'm just getting ready to head off to work. It is 6:05. So it's 6:15 now. I've just hopped in the car. I am a nurse on the inpatient unit at Ashgate Hospice, and I am working a long day today, which is 7 till 7:30 tonight. So I'm going to take you along with me and give you a bit of an insight into what we get up to. Arrived safe and sound at work. Going to head on in, get ready and head to handover. So we've had handover. I'm just heading onto the ward now. I've been allocated to work on admissions this morning, so I'll be attending ward round at about 9 o'clock to see who is on the waiting list to come in. And then we'll look at getting them hopefully over to the ward sometime this morning. Whilst I wait for that, I tend to go around and see if anyone else needs any help with washing their patients, getting people up and ready for some breakfast. So I'll go and get started. Whilst waiting for ward round, I'm just helping out the other teams of nurses that have got patients this morning, grabbing things like cream that they need, helping check meds. We also had an admission quite late last night, so I've just been on the computer using our system 1 to update care plans and make sure everything's in place for him. I started here at Ashgate about 11 months ago now. We're in November. I started in January after several years of working at the local hospital. It was quite emotive for me coming here. We lost my father-in-law here in 2018, and since joining I have spoken to lots of staff who have also got personal experiences of the hospice, and I think it's those experiences and that understanding that make us really good at our job. So I've just completed the ward round with one of the sisters on the ward. We've got one admission coming in today, so I'm going to get things prepped, including the bedroom and the paperwork ready for her coming in hopefully later on. She is coming from a little way away, so hopefully she has a safe journey in, and we'll see her when she arrives. So we've had a slight change of plan. We've found out, unfortunately, that our admission has had direct contact with someone that's tested positive for COVID. So we've managed to relocate her room to down the lavender corridor, which is where we nurse anyone that's got anything potentially infectious. Although she's not tested positive yet, we do like to err on the side of caution and not put anyone else at risk. So she will stay down here. We will COVID swab her when she arrives and wait for the result. But in the meantime, I'm just going to make sure that we've got all the correct PPE to wear, and that her room is prepped and ready for her, which I think it about is. So I was just called to check a lady's syringe drive that had run out. She has had some extra medications overnight, so I'm going to go and have a chat with the doctors and see if they want to increase anything in that driver before we pop a new one up. So I've just spent about an hour off the ward attending a debriefing meeting about a patient that passed away last week. One of the really great things about working at Ashgate is the support that we get from our colleagues, doctors, everyone really within the team. So we've had some time, myself and some other staff, off the ward with some of the medics to discuss through what happened, things we're pleased about, things that we could have perhaps done a little bit differently, try and learn from every experience, and just to talk about how we're feeling and make sure everybody's okay. There were a few tears shed. We try and make this place as positive as we can, but obviously there are sad days. Everyone is a big family here. It really is one Ashgate, and everyone's happy to chat to you, discuss anything, answer questions. There is no stupid questions, and everyone is really happy to get stuck in and teach and help and support. A big part of what we do at Ashgate is medication. We spend a lot of time doing medications, and a lot of what we use is classed as controlled drugs, so it does take 2 nurses to sign them out, take them to the patient. Can be quite time consuming. Contrary to popular belief, not everyone that comes to a hospice comes here to die. We do have patients that come for end-of-life care, but we do also have people that come in that have got a terminal illness for symptom control. So we use a wide range of weird and wonderful concoctions to try and get these symptoms under control and give people the best possible quality of life that we can. So one of my favourite parts about working at Ashgate is the patient care that we get to give and the time that we have. I've previously been expected to look after lots of patients in other areas of work, and at Ashgate the patient to staff ratio is much lower, and that gives you the time to be able to really get to know your patients and really look after them and their families, and it is so rewarding and such a privilege to look after people during some of the most difficult times of their lives. The team here at Ashgate are incredible. I feel really lucky to work alongside some wonderful human beings, and people that really do go the extra mile to make the difference to their patients and their families, and it's a privilege to come to work and work alongside them. Back in the drug room, trying to get things organised for the admission that came. She did arrive a little bit later than anticipated, so it's been a bit of a crazy hour just getting her settled in and getting doctors to see her. She is quite poorly. She is somebody that's come for end-of-life care, so our priority is getting medications on board, getting her nice and settled and comfortable, trying to reduce any anxiety that she's got and any pain, and get a family here to be with her, and try and support them as best we can as well. That is, again, something that I really enjoy about working at Ashgate, is that we don't just look after the patients, we do our utmost to look after the families as well, and offer support to everyone sort of involved in their care as best we can, whether it be us nurses or whether it be the family support team, spiritual supportive care, lots of different people that we can utilise and that can help families come to terms with what's happening, and spend sort of the last hours, days with their family member. As I said, unfortunately she has had contact with COVID, so that's made things a little trickier, and we are wearing full PPE in her room at the minute. I have swabbed her, so we will just await those results and keep our fingers crossed that she is negative, so that we can allow visitors, as we would do normally, to come and be with her. It is 7:25 and we are nearly done for the day, just finishing off a few final bits while the sister hands over to the night staff.